Good evening, everybody. I'm Dr. Lovelena. I'm a senior diabetes consultant from Dr. Mohan's Diabetes Specialty Center, Gopalapuram, Chennai. So today, in the holy month of Ramadan, I'm going to talk about Ramadan and diabetes. So the million-dollar question from all my Muslim friends are, can we fast? The diabetic Muslims, can we fast during this month of Ramadan? That's very frequently asked questions from all my Muslim friends. Before I go into the detail of Ramadan and fasting, for my non-Muslim friends, I want to talk a little about Ramadan. A Ramadan is a lunar-based month and its duration varies between 29 to 30 days. And its timing changes with respect to seasons. Depending on the geographical location and season, the duration of the daily fast may range from few to more hours when compared to the other people who live in a different part of the world. The Muslims who fast during Ramadan must abstain from eating, drinking, using oral medications, smoking from pre-dawn to after sunset. However, there are no restrictions of food or taking fluids or taking any medications between sunset and dawn. So the most people consume 2 meals per day, that is suhoor, that is early morning meal, which is consumed between 4 o'clock a.m. to 4:45, and it differs based on the timing of the suhoor timing. And iftar, that is breaking the fast of the meal, which usually happens between 6:20 to 6:30 this year, especially in India. So during this time, they are not supposed to eat anything or drink anything or take any oral medication. So they will be completely deprived of food and fluids during this time. But after the iftar time till suhoor time, they are allowed to eat fluids or water or whatever they want, feel like, and they are allowed to take medications also. See, the fasting is not meant to create excessive hardship on Muslim individual. The Quran specifically exempts the sick people from fasting. So especially if fasting, which might lead to some serious complications in some people who are like diabetic people, especially type 1 diabetic and patient who are suffering from acute illness like any infections, any fever, or already having any acute illness or any chronic illness, patient who needs 3 times medications for their hypertension or who needs cardiac medications, and or cancer patient or severely ill patients, a tuberculosis patient, we need to take a highly nutritious food during the tuberculosis course of infection. Those people can avoid fasting, especially if the fasting they lead to serious consequences for the individuals. They all fall under the high risk category, so they can avoid fasting during this Ramadan month. This exemption represents more than a simple permission not to fast by from Prophet Muhammad sallallahu alaihi wasallam. God likes his permission to be fulfilled as he likes his will to be executed. Nevertheless, many patients with diabetes still insist on fasting during the Ramadan, thereby creating there is a need for an assessment of the risk of the patients and who are all allowed to fast. So before going into the details of who are all the patients or people who are allowed to fast, I want to talk about the types of diabetes because that plays an important role in this decision. Because there are many types of diabetes. Today I'm going to give detail about the 2 types of diabetes, that is type 1 diabetes and the type 2 diabetes. See, the type 2 diabetes are simply, we can call them as a patient who are only on tablets for the treatment of the diabetes. In type 2 diabetes, they do not require insulin for the treatment all the time, but sometimes in long-term diabetes, they might require insulin for the treatment of diabetes. Whereas in type 1 diabetes, we used to call it as a juvenile diabetes, but it is not called, it can occur occurred at any age time. Even it can occur in the adult people also. So the type 1 diabetes, there is an absolute insulin deficiency in the body. The pancreas is not able to produce insulin, which is necessary for the conversion of the glucose into the energy. So in that case, what happens? The patient has to take the multiple injections, insulin injections, to convert that glucose which is coming from the food into energy. Otherwise, they will not be getting energy because of the food what they are taking. So what will happen? The glucose will be excreted through the urine. There will be a loss of weight, or they will go in for a dehydration, and they can go in for a complications called diabetic ketoacidosis. So in such patients who need the multiple dosages for the insulin dosages for living, so they need insulin dosages before every meal. We call it as basal bolus regimen, because they need insulin. Otherwise, without insulin, that food will not be converted into energy. So in that case, in such type of patients, usually I recommend not to fast, because they fall under the very high risk people, because a risk category. So because they might end up in having complications like hypoglycemia and unstable glycemic control. They might go in for a decay, diabetic ketoacidosis, or recurrent hospitalizations, which can lead to serious consequences. And because the Ramadan fasting is not going to be there for 1 or 2 days or for a week. It is going to be for the one full month, 29 sometimes to 30 to 31 days also. So in that case, so what happens? This prolonged fasting can lead to so many other complications. So basically, the type 1 diabetic people fall under very high risk people category. So I will not, it is not like I will not allow them to fast, but I will advise them not to undergo fasting during that time, because during Ramadan month, because it can lead to serious consequences. At the same time, the type 2 diabetic people, where they do not require insulin for most of the time, but some people require only very minimal medications or very few tablets. In that case, they fall under the low risk category group. So this kind of assessment should take place within 1 to 2 months before Ramadan, because the category is the risk category. There are so many factors involved in that. See, the duration of the diabetes, the age of the patient, and the patient, the HbA1c, that is the 3 months average of the patient, and so many other things. If whether the patient has got any complications because of diabetes, whether the patient on insulin, even if they are type 2 diabetics, some patients might require insulin for the better control of diabetes. In that case, they are not supposed to fast, because they might miss the insulin dosages. And the patient who has got a diabetic nephropathy, who renal complications, because they are not allowed to fast, because the prolonged dehydration can increase or worsen the kidney injuries. In that case, those patients are now advised not to fast during the Ramadan month. And patient who has got other complications like a cardiac complications, or the patient who has got any foot infections or any impending infections with the diabetes, along with the diabetes, like a severe urinary tract infection or a severe many infections which can lead to dehydration. And such kind of patients are not allowed to fast. Why? Because they are advised to abstain from fasting. Why? Because they might go in for complications like dehydrations, or decay, diabetic ketoacidosis, or hyperglycemic hyperosmolar syndrome, HHS syndrome, so many other things which require hospitalizations. And in between, they might we will advise them to break the fasting. And one more thing, in the Ramadan month, as I said, that the patient has to wake up at the middle of the early in the morning, especially at 4 o'clock, 3:30 to 4 o'clock, to have their suhoor. So this will affect the sleep pattern. See, when the sleep pattern affects, that also disturbs the control of the diabetes. The sleep pattern is changes in Ramadan month, which is also has got an impact on the glycemic control. So the risk assessment has to be done 1 to 2 months before the Ramadan month, and we have to categorize according to the risk factors. If the risk factors, we have actually, it is not just like that. There is a designed category where we can assess the risk factors. Based on that, we will, if the risk score is less than 3 or less than 6, then they fall under the low risk category. If it is less than 6, that is moderate risk category. If the risk score is more than 6, they fall under the high risk category. Usually the low risk category people and the moderate risk category people are allowed to fast with some precautions, some dose modification, some dietary modification, and continuous glucose monitoring is also very, very important during this time. And the patient who falls under the risk category of more than risk score of more than 6 are not allowed to fast or are not advised to fast. Who am I to allow? Who are not advised to fast because that can lead to the serious consequences at a later date. See, again, in diabetes, with the patient who has got the complications, it is the acute fluctuations, that erratic sugars, which can cause the fluctuations in the glycemic control, can worsen the complications like diabetic retinopathy, diabetic nephropathy, or in diabetic cardiomyopathy. These kind of complications can get worsened because of the erratic food pattern or erratic timing of food or erratic glycemic control. So usually I would advise my patients who fall under the high risk category, that is more than 6. So if I say it's more than 6, you might not be able to understand. So if see, I to be on a briefly, I want to say these are the people who are not advised to fast. These are the people who fall under the risk category. So number 1 is the patient who has got an HbA1c, that is the 3 months control, more than 8%, that is poor glycemic control. Number 2 has got a persistent high sugar, persistent HbA1c of more than 8 for a longer time, more than 2 years or 3 years. And patient who gets recurrent hypoglycemia, so that is more than 2 to 3 episodes every week, or daily mild hypoglycemia, or patient who has got an hypoglycemia unawareness, that is the patient might not be able to sense the symptoms of the hypoglycemia. Usually hypoglycemia causes symptoms like excessive hunger, excessive sweating, palpitations, and a little confusion, some confusion, some some other if they add if during sleep they get sleep disturbances. There are few symptoms for the the glycopenic symptoms for the and neurogenic symptoms for the hypoglycemia. In prolonged diabetes, or the long duration of diabetes, or in poor control of diabetes, or in patient who has got an autonomic neuropathy, it's one of the worst complication of diabetes, or patient who are under the are very old patient can develop something called an hypoglycemic unawareness, where the patient might not be able to sense the symptoms of the hypoglycemia. Such kind of patients, when they are allowed to fast, what will happen? Even if they get the hypoglycemic attack, they will not be able to sense the symptoms. So they might end up in having a hypoglycemic coma. So in such cases, we will advise them not to fast. So these are all the people who fall under the high risk category. So who are all people who are allowed to fast? Who are the low risk people? That means the people with type 2 diabetes, number 1. Number 2, who has got an HbA1c of less than 8. That is the good glycemic control or the fairly good glycemic control. A patient who does not have any complications because of diabetes, like diabetic retinopathy or nephropathy or neuropathy or foot infection or peripheral vascular disease. And patient who does not experience hypoglycemic attacks, and patient who are only on tablets, or patient who has gotten only 1 single dose of insulin along with the tablets, or 2 injections along with the tablet, who has got a good control of diabetes, or allowed to fast with little precautions and with little modifications in their drug. So these are all the patients are allowed to fast during time. See, when they are allowed to fast, they have to do a frequent SMBG, that is self-monitoring of the blood glucose is very important. They have to record their blood sugar before the suhoor time and after the iftar time, after the dinner time, at least 4 values per day to prevent them from getting hyperglycemia or the hypoglycemia, that is very high sugar or the very low sugar. If the patient, even during fasting, they are allowed to check the blood sugar, they can check the blood sugar, that is not an issue. If they get any symptoms like giddiness or excessive hunger, excessive palpitation, or excessive sweating, we will advise them to check their blood sugar with the help of the glucometer. If the blood sugar is less than 70 milligram per deciliter, or if the sugars are more than 300 milligram per deciliter, better to break the fast, because this low, that is hypoglycemia, which is less than 70 during the fasting, can get worsen if the fasting is continued. Or the hyperglycemia can also worsen the dehydration, which can lead to the complication. So when the patient gets such kind of symptoms, they are advised to check the blood sugars. In the values, the sugars are less than 70 or more than 300, they are requested to break the fasting, because that can lead to complication. And as I said earlier, it is okay to draw blood or check blood during fasting. And the exercise are also an important factor in the glycemic control, as we all know. So during Ramadan time, if we are not able to do exercise, then that can also lead to the hyperglycemia, that can worsen the glycemic control. So the exercise are encouraged during fasting time, but the timing of exercise is very, very important. So the timing has to be at least 1 hour before the iftar time or after the iftar time. That is 2 hours after the iftar time, where after taking the heavy meals, you are not supposed to walk or do any exercises. So either we have to start doing exercise half an hour or 1 hour before the iftar time, so that after the exercise we can take plenty of fluids during the iftar time, or we after finishing the iftar 2 hours after the iftar time before the dinner time, we can advise the patient to go for a walking or minimal weight training exercises. And in that case, the glycemic control will also be maintained even if they are fasting. And if the low risk are allowed to fast and moderate risk are also allowed to fast, the moderate risk people are the people who are on a type 2 diabetic, who are on not multiple dose of injection, 1 or 2 doses of injection. They're also with the minimal complications like or a mild, it's not a mild retinopathy or mild neuropathy. Such kind of patients fall under the who doesn't have a recurrent hypoglycemic or who does not have an hypoglycemic unawareness. Those are moderate risk group. They are also allowed to fast, but with certain restriction. Like as I said earlier, the continuous glucose monitoring and with minimal of exercises and some dosage changes, they are allowed to fast. And number 2 is the diet. Diet plays a major role in the control of diabetes. It's not just only the medication which helps us to bring down the blood sugar. Diet plays a major role. So usually the iftar and suhoor, usually the Muslim friends will take a high carbohydrate meal and high sugary meal, because that increases, that raises the blood sugar just like that. So they always want the high carbohydrate sugar, high carbohydrate food or high glycemic index food during that time. But in diabetic individual, I would advise them not to go for the high carbohydrate food. So they are advised to take a low glycemic and less give more importance to the protein food, like the high protein diet, like they can take chicken for iftar, they can take nuts for iftar, they can take their dal and roti, or they can have a boiled channa or grams. So these items, the high protein items, can be taken during the iftar time, because in that case the sudden surge in the blood sugar will not be there. So there will be a sustained release of glucose from the body. The sugars will not have the huge fluctuations. The chances of hyperglycemic surge will not be there in such cases. So what are all the food advisable? Usually the iftar time Muslim friends will have this nomb porridge. In some of the parts of India, they take something called halim, which is made of broken wheat and lots of meat and oil and high fat diet. And some people in South India, they prefer that nomb kanji, that is fasting porridge, which is made of rice and little dal with lots of vegetables. These are high glycemic index and high calorie food. They can try to avoid, and they can do certain modification in that fasting porridge or no kanji. They can make that kanji, that porridge, out of millets. They can try like this foxtail millet or barnyard millet. Such kind of millet can be used, or brown rice can be used in the place of this white rice or the parboiled rice. If there, or the raw rice can be replaced with this such kind of millets or the brown rice in making that porridge. And the porridge can be made with like adding extra dal, and they can add extra vegetables to increase the fiber content, and they can add the protein like chicken or mutton. That is red meat, a little amount of red meat to increase to lower the glycemic index of the food, to increase the protein value of the food. And number two, they would love to have some fruits soon after, because they'll be completely exhausted and dehydrated. They would love to have some fruits, but they can avoid high glycemic index food like watermelons or mangoes or jackfruit or chickus or pineapples and grapes. These are high glycemic index food. Instead of that, they can try taking apple, pear, mosambi. They can have oranges, strawberries, blueberries, such kind of fruit or low glycemic index fruit, and these fruit will not increase the blood sugars just like that. And number three, and they want to have something like a juice soon after or the iftar time. So in that case, they are advised to take some lime juice with salt, or some tomato juice with salt, or some thin soups can be taken, or chilled milk or buttermilk can be replaced in the place of high calorie non-fibrous juice. Instead of that, they can try taking this buttermilk or lassi without salt, or chilled milk without any sugar, or if they want that sugary taste, they can add a little bit, 1 or 2 tablets of sugar-free or sugar-free alternatives. And they can also have lime water or mosambi water with salt can be replaced for this ruafza, rose milks or fruit juices, which are high glycemic index. And the timing of food is also very, very important. They can have the iftar, and they can do some exercises after 2 hours after iftar, a little of walking or some weight training, and dinner can be delayed to 10 o'clock or 9 o'clock, so that wild fluctuations in the blood sugars will not be there. And the medications can be the morning dosage of the medication, that is that usual morning dosage can be taken in the iftar time, and the night dosage can be taken in the dinner time. And some patients, I would advise them to have some medications during suhoor also, if required. So this iftar time, the patients who are on one-time insulin, that is only basal insulin, and other tablets, I usually advise them to have that insulin after the dinner, not after the iftar. The tablet can be consumed during the iftar time and the suhoor time. If the patient is on certain medications like metformin, or the certain medications like gliptins, which usually we call it as sitagliptin or vildagliptin or linagliptin, such kind of medications does not require any dose modification, because those medications does not cause hypoglycemia. So these medications without any dose modification can be taken during iftar time and the suhoor time, or during the dinner time and the suhoor time. And some medications like sulfonylureas, which is commonly used in diabetic individuals in type 2 diabetes. The certain sulfonylureas like glibenclamide, glimepiride has to be avoided during such times to prevent the hypoglycemia. Glibenclamide, I will completely advise the patient to avoid. Glimepiride can be used, but the dosage modification is highly recommended. The dosage can be reduced, and the morning dosage can be introduced during the iftar time, and the night dosage can be introduced in the dinner time or in the suhoor time. And The insulin, if they are only on the basal insulin, they are allowed to take in the without any dose modification after dinner, or if the patient is on two pre-mixed insulin, the dosage reduction is required in the suhoor dosage, but the morning dosage can be taken in the iftar time. The same dosage, the dosage modification is not required. If the patient is on a multiple dosage insulin along with the OHA, I usually recommend them not to fast. But if they insist on fasting, they can skip the lunch dosage. That is, the lunch dosage cannot be taken, so that dosage can be skipped. So the other dosages, morning dosage and night dosage, can be taken during the iftar and the suhoor time with the advice from your diabetologist or the physician. You have to meet the physician and they will reduce it. Please do not reduce the dosage or add dosage on your own. Please visit your diabetologist on time. These risk assessment and the dosage modification has to be done 2 to 3 months prior to the Ramadan, so that they will start doing dose adjustments. They will bring down the HbA1c to less than 7, and the patients, my Muslim friends, can fast during this holy month of Ramadan without any fear, with the dosage modifications and with all the recommendations from your diabetologist and the physicians. With all the lifestyle modification which I told you now, and with all the advices and the risk assessment, the Muslim friends can fast during this month without any problem. So now I'm ready to take questions from you all. If you have any questions, you can just chat in the comment box. I'm ready to reply your questions. I'm able to see some questions, but okay. See, I have got a question from Mr. Chandra Prakash, but it's nothing to do with the Ramadan and fasting. But still, I am ready to answer this question. My feet is burning. My postprandial sugar is 220. Every alternate day it happens. And I did not take proper tablet. I'm taking 250 milligram glyciphage 2 times a day and Ondaramet before the breakfast and Pevisca plus any solution. I'm 66-year old. Hello, sir. Good evening. And yes, your sugars are not under good control. You have not mentioned about your HbA1c. So you have to bring down the HbA1c so that you will not get any feet burning. The sugars are high because of neuropathy. The feet burning is a commonest complication of any hyperglycemia, commonest symptom of hyperglycemia. Before treating that symptom, you have to bring down the sugars to the ideal level. The ideal level is fasting should be less than 120 to 130, or postprandial should advise to be less than 160 to 180, and the HbA1c less than 7.5 to get rid of such kind of neuropathic complications. I think I would like you to come down to a center or reach out any nearby center in Dr. Mohan Center in place where you're living now, and you can get your HbA1c checked, and my diabetologist will be more than happy to help you in this regard, sir. And I have not got another question from Mr. Aman. My dad had a knee bone operation 2 years ago and got installed a screen. He has diabetes for more than 15 years, and when he should know for a knee operation to remove the screw. I think this is not for us. You have to talk to your orthopedician, and then he is the right person to answer this question. Your average clearly explains the risk of diabetic fasting. Thank you, madam. Thank you. As protein deficiency leads to low hemoglobin. See, the protein deficiency is not directly related to low hemoglobin, but if the patient has got a protein deficiency, that means there is a serious nutritional deficiency. So indirectly, it can cause low hemoglobin. So they have to increase the protein in the diet and the vitamin C and the hemoglobin, iron enriched food in the diet to get rid of this anemia. I have frozen shoulder problem. Any remedy for this? See, we have to find out the reason for the frozen shoulder, sir. If the glycemic control is the reason for the frozen shoulder problem, then we have to control the blood sugar, and then we have to treat the frozen shoulder. And there are multiple causes, not just only the diabetes is reason for the frozen shoulder. There is something called periarthritis, which can occur even without diabetes. So we have to find out the cause. We have to take the X-ray if needed, MRI, get in touch with your orthopedician, find out what it is, what is the reason for it. If the sugars are not under control, please do control your sugars before you go in for treatment for the frozen shoulder. Mrs. Vijayalakshmi, as I was told that we cook the foxtail millet brown rice, the fiber content is lost. No, madam, the fiber content is not lost because the glycemic index slightly goes above the usual glycemic index when while cooking, but fiber content doesn't get lost. Only the while cooking, only the vitamin and nutrition can get destroyed, but not the fiber. So the fiber content in the brown rice and the again the millets, it has to be the whole grain millets. It's not just the refined. If it is a refined millet, again the fiber content will not be there. If it is a whole brown rice or whole grain millets, the fiber content is not lost while cooking. Mr. Anush Singh has asked, good evening, madam. My dad has numbness in his left palm and wrist area. Please suggest any remedy for this. Again, sir, again and again and repeating, we have to find out the cause. If diabetes is the cause, we have to bring down the sugar, or n number of causes are there. It can be because of cervical spondylosis. It can be because of carpal tunnel syndrome. So many other orthopedic causes are there. We have to evaluate, and he is told that his father's fasting is around 120 milligram. That means the sugars are under control, but at the same time, by seeing one single value, I cannot say his sugars are under good control. We have to see the HbA1c, and then only we'll be able to find out what is the reason for this. Mr. Srinivasan, my weight is lost due to COVID-19 from 95 to no diabetes, sugar values of 94. 2 hours, my conventional blood sugar test, glucometer is 90. Is it due to? Yes, sir. The COVID is causing weight loss, but you will get it back with good nutrition. But if it is 95, then definitely for your height, it should be an overweight by I don't think you need to increase your weight. You have to get back to 95. You might end up in having diabetes. So try to maintain that 77 kilograms and try to take healthy diets, sir. My HbA1c is 8.1. Is it an alarming figure? I'm 74. Considering your age, 8.1 is not an alarming figure, sir. But if it is left untreated, it can go to 9 or 10, which can cause complications at a later day. So try to control the sugars. The too much of tight control is not required at the age of 74, but at least 7 to 7.5 is an ideal HbA1c for anybody who is above the age of 70. Yes, Mr. Anshu Singh has said it is HbA1c 6.3. Then the numbness might not be because of diabetes, sir. We have to rule out other causes like cervical spondylosis or any nerve compression or carpal tunnel syndrome. So I think you have to get in touch with a neurophysician or an orthopedician to find out the cause for the numbness for your father. So, Mrs. Vijayalakshmi, I have excess protein release in my urine. As a layman, I feel, why should I consume more protein, which is pushed out? So, madam, you have not mentioned about your excess protein release in your urine in your prior question. That's why I said you have to push yourself with high protein diet. If you have excess protein release, then we would we would advise you to go for a protein restricted diet, but not too much of restriction. 35 grams per kilogram body weight is an ideal protein intake for the person who has got the we call it as micro or macroalbuminuria. 35 grams per kilogram is per kilogram. That if you are a 50 kilogram person, then we are not getting that much of protein from the Indian diet. So the protein restriction is not required especially if you are a vegetarian. Protein restriction is not at all required because our Indian diet does not fulfill our daily protein requirement. Yes, Mr. HB was, my hemoglobin was 13, but during COVID it has come down 12.5. Not much of 0.5 is expected in any acute illness, sir. That's not a great concern. Have a high protein and high iron-rich food. Thank you. I think I'm getting questions only about the diabetes, not about the Ramadan and the diabetes, but still I'm ready to answer those questions also. Okay, somebody has asked about, sir. I have so you can see there is that our hospital numbers is scrolling down below my Facebook live. You can get the help of those persons for your appointments and other details, sir. This is for Mr. Tirumala Govindarajan. I think I have done with my questions, but still it will be available in this session will be available in the YouTube. If you have any further questions, you can still ask the questions in the comment box in YouTube and in the Facebook also. So I'll be able to answer such questions at a later date. If you have any doubt in diabetes, or if you have any doubt in Ramadan and diabetes, you can still ask questions in the comment box. We'll be able to answer even after this live session in a Facebook, or in the I can give a reply in the YouTube comment box also. Anyway, thank you so much for listening to me. I think I have clearly explained about the Ramadan and the types of diabetes, and who are all the people who are allowed to fast during diabetes during Ramadan month. And I think those risk factors assessment can be done at least from the next year onwards. You have to assess your risk factor before going for a fasting during the Ramadan month. And I wish you all a happy Ramadan and a safe Ramadan. Thank you so much.